Hey everyone! I am driving on my way back from Fuquay. I did anesthesia today, and you know, I've been going through it. So for those of you who've reached out, who prayed for me, who've just said, hey, I'm thinking about you, please keep that up. It means the world to me. But it also dawned on me that I have not been on here sharing anything about functional medicine in a little while. I've been doing videos and, you know, some still pictures and that sort of thing, but I haven't been on here to talk to you in a while. And so I thought today's the day. So a couple things that I want to talk about. Two of the most common things that I hear from people are about cholesterol, that their doctor wants to put them on cholesterol medication. There's not really any talk about the risk-benefit ratio of that. When I start to ask questions about family history and other medical conditions that they have and what their cholesterol levels are and did they have this test done and that test done, many times cholesterol lowering medications, statins, are being recommended as a first line treatment without much talk about what you can do as far as diet and exercise and lifestyle changes to help your cholesterol. There's not really any talk about what that cholesterol number is showing and if it does indeed affect your cardiovascular risk. So I wanted to talk about that just for a moment. And there's going to be a lot of people, well, maybe not a lot, some people who disagree with this, and you can go look in the literature, and you're welcome to disagree with me on here. I'm probably not going to answer every single disagreement. I'm just going to say this. The literature does not support that cholesterol alone increases your cardiovascular risk. Doesn't really matter what your cholesterol is. As a matter of fact, there are some studies out of Japan and other places that show, now this is not causal, so it's not saying that a high cholesterol causes these people to live longer, but in the blue zones where people live over 100, cholesterol numbers are significantly higher than other places, and it would be beyond the numbers that we get treated for high cholesterol here in the U.S. So I want you to look at, some statistics that are out there, and it shows that since we've introduced statins on the market, we haven't decreased our cardiovascular risk, but we have seen an increase in our Alzheimer's risk. And that's significant, and I believe that it's related. Here's why. 85% of your brain is cholesterol. For all of you people who come and say, my hormones are messed up, most of your sex hormones are cholesterol based, meaning that you have to have that cholesterol scaffolding in order to build your hormone. So those two things right there in and of itself are reasons for me to give you this additional information, because it's really common that people are saying my hormones are all messed up, and they're also saying, well, Alzheimer's runs in my family. I don't know about that. So I just wanted to put it out there. If you are being told that your cholesterol is high, one of the things that I want you to understand is that your body produces cholesterol. So if you don't have enough cholesterol in your diet, then your body is going to produce cholesterol. It is that important to every cell in your body, and your cells can produce cholesterol. What I see is that cholesterol shows up to the party to actually help your body to lower inflammation and to repair where inflammation has caused some damage at the cellular level. Here's another thing that I want to mention is that, a lot of our hormone signaling, even those hormones that don't have that cholesterol scaffolding, the hormone receptors and the cell membranes are made up of about 40 to 60% cholesterol. So even if the hormone that lands on that receptor isn't made out of cholesterol, the hormone receptor is. And so we wonder why, when we are treating and lowering our cholesterol, and there's some people that I've seen, their cholesterol's been 143, 158, and their doctor's happy with that. That increases your risk of Alzheimer's if your cholesterol is that low. It also increases your risk of hormone issues, poor signaling. It influences how your cell is responding to hormone messages because the message just isn't getting through. Also, a lot of us are talking about the fact that we don't have energy. I wake up, I sleep 8 hours, but I wake up tired, or I'm not sleeping 8 hours. I feel like I have an afternoon slump, or I'm tired all day, I have no energy all day, I just lay around, and then when it comes time to go to sleep, I'm wide awake. So part of that has to do with the fact that your cells require hormone signaling in order to know how and to be efficient in creating energy at the cellular level. And here's another thing. Your cell membrane, your mitochondria that live in your cell, they are the powerhouses of the cell. They're much more than that, but they are the powerhouses of the cell, are about 90% membrane. That's the whole kit and caboodle that we make the energy for our cell is all membrane. And so if our cholesterol levels are low, then our mitochondria are not going to be working well because they just don't have the scaffolding in order to build that mitochondrion in order to do the work to create that energy. So lots of reasons for you to have a longer conversation. And I'm not saying that statins are not going to be right for anybody. I'm just saying that you really have to know your risk, and you have to know what benefit you expect from the medication and if it's going to be a true benefit for you. Because just treating cholesterol but never knowing whether you have a genetic predisposition, just because high cholesterol runs in your family or cardiovascular disease runs in your family, does not mean that your cholesterol is influencing your cardiovascular risk. Doesn't mean that that's why your cholesterol is high. It's not. It doesn't work like that. Usually, the things that cause us to have a higher cholesterol number are inflammation. That comes many times from the condition of our microbiome, how healthy our gut is, how much inflammation we have, and your body is going to increase cholesterol in order to fight that inflammation and in order to repair that inflammation. So the things that actually cause the inflammation might not be hereditary, but our lifestyle, our habits, our diet, those get passed down. We learn how to eat and cook and how to deal with stress and our lifestyle habits, whether we're an active family and we get outside and, whether we deal with stress and that sort of thing. That gets passed down as well as a genetic code does. So I think that too many times we blame our genetics on something that's really a lifestyle habit. So a couple of other things, and I've made some videos about this recently, but a couple of other things that you need to know is that cholesterol is kind of the cargo, but you need to know how many trucks are carrying the cargo to better understand your true cardiovascular risk. That has to do with ApoB. That is apolipoprotein B, tells us how many vehicles are actually on the road, right? And that will influence. The more traffic that you have in your cardiovascular system, the more chance there is of a pileup or of wrecks, of potholes, that sort of thing. There's another marker that I would like for you to, if you truly are being told that you have a cardiovascular risk, then I want you to know what your lipoprotein little a, that's how we say it. It's a LP in parentheses little a. And that is a genetic link. That one actually is genetic. And, you know, there's not a whole lot that you can do about having that as a risk factor other than controlling other risk factors that compound it. That would be things like being overweight. That would be things like smoking, being sedentary, not getting enough sleep, having a diet high in saturated fats, having a diet saturated fats, not fat, saturated fats, having a highly processed diet. Those are things, having diabetes, those are things that will actually compound that genetic risk that you have. So you need to know what your lipoprotein A is, because that's your genetic link. And then you also need to know what your homocysteine is. And homocysteine is one of those things that has to do with methylation, but what it ends up telling us about is what is the condition of your vasculature. What do your blood vessels look like? Are they sticky? Are they inflamed? That's really what that homocysteine shows us. You can also have something called a highly specific CRP, hs-CRP, and that's a general marker for inflammation. That one's less specific than the other ones, but it's, you know, if they're getting markers, that's one that they'll normally get for you. But you really need all of these, because it doesn't matter how much cholesterol is in your blood. It matters how many trucks are on the road, whether you have that genetic link that causes things to be generally inflamed, and whether your vasculature is inflamed. Those are things that make a difference. So if you're having the conversation about, you know, whether to start a statin or not, I want you to ask some questions. I want you to get some answers. Advocate for yourself so that you can actually know whether you have a true cardiovascular risk from all of these things, or whether your cholesterol is elevated because you have inflammation, and it's actually trying to lower your inflammation and protect you. So our bodies are divinely made, and you'll hear me say this all the time. A lot of times we just have to get out of the way in order for our bodies to be able to heal itself. And another way that that happens is when we have thyroid issues. So many people come and they're like, well, they got a TSH and they told me that my thyroid was normal, but I have trouble losing weight. I feel sluggish all the time. You know, I just don't have any energy. I'm not sleeping well. I mean, all the things that we can often attribute to a low functioning thyroid. And just checking a TSH is really a screening tool, but if you're having these symptoms, you need to look a little further. First of all, you need to get a couple of antibodies to know whether there is something that's actually attacking your thyroid and making it not work so well. A TSH actually only shows the message from your brain to your thyroid. It doesn't give you any information of whether your thyroid is actually responding to that message, and whether your body is actually able to convert that inactive thyroid hormone, which is 80% of what your thyroid produces, has to be converted to active thyroid. And that's the one that actually gets into the cell and causes your cell to increase its metabolism. But here's what most people don't know, is that if you have inflammation, if you have a lot of stress, like physiologic stress, if you are insulin resistant, if you have some mineral deficiencies, if you have poor gut absorption, you know, all of those sorts of things, if you have that condition going on, your body is going to protect you at all costs. And so the last thing that it's going to do in that situation is use up the materials that you are working so hard to absorb from your diet. It's not going to use that to create this active thyroid hormone that's actually going to increase your metabolism, because it doesn't know that you're safe yet. It doesn't realize that your body's not under attack. And so what it's going to do, instead of converting inactive thyroid hormone, which again is 80% of what your thyroid puts out, into active thyroid hormone, it actually converts it into something called reverse thyroid hormone. And that actually is kind of like if thyroid hormone, active thyroid hormone, is like a key to open the lock to the cells so that thyroid hormone can get in. This is like having a key that breaks off in the lock, and it prevents that thyroid cell from being, or that cell from being opened to allow thyroid hormone in. It's a way to protect you. It's not going to allow your metabolism to increase and burn through those precious materials that you have, or that you might be already showing that you're a little bit deficient in. It also, if you've got a lot of sticky things from metabolism anyway, because you're kind of inefficient in your metabolism, if you're burning glucose a lot, that's a dirty fuel in your cell. It creates a lot of stickiness, a lot of rust. If you already have a lot of that going on, the last thing your body wants you to do is to create more of that until you are able to detox that, until you're able to calm that inflammation down. So you will need to get a reverse T3. And very few people come to me and have ever even heard of that. A lot of people are just getting that TSH, which is only part of the loop. You know, it's only part of the thyroid loop and how the thyroid works. It's actually not even a thyroid hormone. It's a brain hormone that talks to the thyroid. So I want you to realize, you know, so many people come and they say, I have no energy, I feel like I'm broken, I don't know if this is just age, if this is just my hormones. But a lot of times your body is putting the brakes on things so that it can actually protect you, so that it can conserve energy, so that it can conserve your minerals and enzymes that you're working hard to produce. So the fact that your body isn't responding like it should, like it has in the past, or like you feel like it should. You know, a lot of people will say to me, everything that I've done, you know, that used to work for me to lose weight or to feel better or to have more energy or to sleep better or any of that isn't working anymore. And that's because your body knows how to protect you, and that's exactly what it's doing. It's putting a block on everything that you're trying to do. And many times, if you're pushing the system too hard, your body's just going to lock down even further. So you really need to understand that there's a root cause. Many times it's inflammation. Sometimes it's the fact that you don't have the right, you know, your diet isn't made up of the right kinds of things. I mean, we need fat, we need protein, and we need carbohydrates. But those carbohydrates actually need to come from whole foods instead of processed foods. Those fats, you know, we talk about healthy fats. That includes animal fats and plant fats. It does not include processed food fats. That's the big difference. It doesn't you know, include those things like fast food, fried things. You can fry in butter, you can fry in ghee, you can use olive oil, avocado oil. Those are healthy fats. And like I said, it's not all just plant fats. You also have to have proteins, but so many times people think that you are burning protein to create energy. And actually, protein is used in the body to build and repair. And you want to be using your glucose for quick energy and your fats for long-term energy. That's what really produces that energy in the cell. If you're having to burn protein to create energy, first of all, it's very inefficient. It also it burns kind of a dirty fuel, but it's inefficient, meaning that it only produces about 1/4 the amount of energy, ATP, that burning fat in the cells actually do. So this just goes back to the idea that you can't force your body into submission. You can't force your body to do something. And a lot of traditional medicine is all about that. It, first of all, is to shut off the window that we have into what's going on in the body and seeing how all of our symptoms are related. So we're really doing whack-a-mole with our symptoms, but those are a window inside our body to let us know what is most likely going wrong. That's why whenever I have somebody that comes to me, we do an hour-long intake interview, because I want to know what symptoms you're having, when, what makes it better, what makes it worse, what time of day, all of that, because your body is sending out distress signals. And if you're turning those distress signals off, no wonder we're not getting better, because we don't know where to look. We don't know what to treat. And I don't ever want to just shut off your symptoms. We certainly want you to get relief from your symptoms, but we want that to heal naturally, because we've actually healed the root cause. So that's a lot of information, but I just felt like it is literally over and over and over and over again. Almost every single person that comes to me comes and talks to me about cholesterol, about thyroid, about the fact that their body is no longer performing like it used to, and it makes them wonder if this is just part of aging, if this is a hormone imbalance thing, or if this is something that they're going to be stuck with forever. If you get to the root cause of it and you repair some of that, then your body knows how to work. Your body knows how to release those brakes that it has put on your metabolism and hormone production and hormone activation and all of that sort of thing. So, all right. I hope that helps somebody today. And again, thank you all so much for reaching out and just, sending me lots of loving messages and lots of hugs and prayers. I really appreciate it. Keep them coming.